they start having depression, the issues of depression, stress and anxiety, yeah, and the issues of alcohol abuse or drug and substance abuse, because they think that their life has ended. Yeah.
Okay, we have also been hearing that someone with HIV and AIDS is HIV and AIDS still get vaccinated. Or in other words, I'm trying to say that a person who is suffering from HIV and AIDS can get any vaccine. Just because we have been hearing that a person who is suffering can no longer get any vaccine, just because vaccine like COVID-19 vaccine can disturb the medication of HIV and AIDS.
Okay. People with HIV can get vaccinated. It's possible, and it's very true. They can get vaccinated against many diseases or infections. Yeah, but it just depends. There are some vaccines. There are different types of vaccines. We call them toxins. We call the other vaccine called live vaccines. So with live vaccines, it just depends that if your I can say CD4 count is high, you can get vaccine with live vaccines. It just depend with your CD4 count. Yeah, you can get vaccinated with any vaccines like hepatitis and the like.
Okay, in other words, you're trying to say that vaccine do not disturb ARV.
Yeah, and they don't disturb ARVs.
Okay. We have also been hearing that HIV can be transmitted through mother to child transmission. Is that information clear?
Yeah, it's true. You can get infected from your mother while you are. Yeah, it's true. Yes, it's true. You can get infected from your mother in her womb or through delivery. Yeah, it's possible.
Okay, how can a mother to child transmission of HIV be prevented? Is that nurses can do something possible to prevent a child who is being conceived, to protect him or her, so that he should not born with HIV?
Yeah, there are measures which prevent a mother to transmit the virus to her unborn baby. The measures like when a mother is pregnant in a antenatal clinic, or mothers or pregnant mothers are tested HIV. So if one is found, she starts ARVs. She takes ARVs until her life. So when the baby is born, there is a prophylaxis drug which is called nevirapine. So a baby is born from infected mothers. They are given nevirapine from day one to up to 6 weeks. So this medication acts like a prophylaxis to HIV. So they are tested at 6 weeks. They are tested at 12 and 24 weeks.
24 weeks for just HIV and AIDS.
Yeah, for just HIV. Yeah, to the child. A child get tested from 6 weeks, 12 weeks, and 24 weeks.
Okay. How often should someone with HIV see the health care provider? I'm asking you this question because we have been hearing that a person who is suffering from HIV is supposed to go to the hospital frequently. So how often should someone go to the hospital?
Uh, if you are new to infection, if you are new to HIV infection, mostly you have to visit hospital monthly.
Monthly.
Yeah, so that the healthcare provider can can check you and give you some advices. Yeah, and he or she notices your drug adherence. She gives you support and the stuff like that.
We've been hearing that a person who is struggling to this deadly disease is supposed to drink drugs each and every day. Is this information clear, or those are the liars?
It's clear you have to take ARVs on daily basis.
Okay, we've also been hearing that you nurses, you hide most of the time drugs, which has been helping you to drink it on a 1 month. Okay. I think you get what I'm trying to say.
I can elaborate it. I'm not getting it.
Okay. In other words, I'm trying to say that at you nurses, you have a drug which person can drink at once at a month.
Once at a month?
Yes, not each and every day.
No. There are no such drugs. I've never seen them. Maybe, but there are no such drugs. They are just ARVs. If it is painful, you take it after being exposed. You take it for a month daily for 30 days. So maybe it's painful. Maybe you are trying to mean.
No.
Okay. So
Okay.
there are no drugs.
Okay, no drugs. All right. We have also been hearing that a person who is struggling into this deadly disease, HIV, can no longer have a child. So, can someone with HIV have a child?
Yeah. It is true. You can have a child, a child who is free from HIV. It's possible. Like I said earlier, that there are measures. We call them PMTCT, prevention of mother to child transmission. There are those measures. So those measures prevent a child from being infected.
Okay, we've also been hearing that when a person who is suffering from this disease, virus which is in his body destroy or damage fallopian tube, so which can prompt a person not to manage to bear a child.
No.
Are those speculations false?
Yeah, false. Because HIV, it is just act on immunity. It does not deal with the. It does not deal with body organs. Yeah, it just deal with immunity.
Okay, all right. We have also been hearing that HIV can be cured. A person can recover from this disease. Is that information clear that a person can recover from HIV and AIDS?
According to World Health Organizations, there are no drugs which cure HIV. There are no drugs which cure HIV. So there are some rumors that there are certain drugs which cure from HIV, but those drugs are not recommended. Are not recommended. Are not. They are just rumors. They are just rumors. So maybe it is true, but the World Health Organization, World Health Organization,
To not recommend those drugs.
Yeah, do not recommend those drugs.
In other way,
HIV has no cure as of now.
Okay, in other way, you're trying to say that you, after you suffering from this disease, you cannot recover from this disease.
Yeah, you cannot recover. Maybe
because you are a specialist in this issue.
Yeah, according to books, according to World Health Organization, HIV has no cure, has no medication that cure it.
Okay, but we have also been hearing that you nurses, you have studied a lot of nurses that which can prompt you to make a drug. So how come you are failing to make a drug which can cure HIV?
It's a lie. We haven't learned those. We don't have those information that we can make drugs. Yeah, it's not our job to that is a job for certain scientists and
but you're also a scientist.
Yeah, I'm a scientist, but I don't go beyond that.
Okay, but I'm asking you this question because during the first year, students who are studying this course nursing, they learned about making drugs.
No, we don't learn about making drugs. That we learn during the first year, we call it pharmacology. It's just a course which guides us how to be safe with drugs, how to know drugs, how to prescribe drugs, how to give drugs. It's not necessarily making drugs. It's just a course which guides us to. It just guides us to have information about drugs.
Okay, we have also been hearing that HIV transmission can be prevented. Is this information clear that we can manage to prevent HIV transmission?
Yeah.
What are the ways of preventing HIV and AIDS?
There are many ways. Like the way, as youth, we have to use condoms. You have to be, or like couples or youth, we have to be faithful to our partners. Yeah. As for HIV, as of HIV pregnant women, they have to follow those measures, PMTC measures. They have to follow those measures. Yeah.
I think you forget to say that abstinence can be the most or effective way of preventing HIV and AIDS.
Abstinence is the most way of preventing HIV, but nowadays abstinence is very crucial as of youth. So I can just give the manifest to compromise.
Okay, but we've also been hearing that the playboy, using of playboy is the best way of preventing HIV and AIDS. Is this information clear?
It's clear. It's clear. It's true. A playboy prevent someone from getting HIV/AIDS.
Okay, as we are approaching to the end of our program today, maybe you have something to share with our audience. What is your view?
Okay. HIV is preventable. You have to be careful. You have to we have to stay away from behavior which can put our lives in danger, like or issues of drug abuse and the like. Yeah.
Okay, remind us your name.
And my name is Victor Nyirenda.
Okay, this marks the end of our podcast for today. Stay there next time as we are going to give you another brilliant, fantastic